we all know that every disease, every degenerative disease, except for one that I know of that's a sodium deficiency, but every other disease is a disease of inflammation. At the cellular level, the cell's on fire. And the question is it a brain cell or a kidney cell? Is it gasoline or kerosene? But it's always a fire. So whatever your health concern is that you want to deal with, you always have to ask the question in the pretty early stages, who's throwing gasoline on the fire? Is it what I'm eating? Is it what I'm breathing? Is it what's already accumulated in my body from years of toxin exposure? What is it? Where is the gasoline coming from? And there's usually many sources. But in this era of the pandemic that we're in right now, people are worried about will they have or are they vulnerable to having a severe reaction with exposure to the virus. So I want to talk a little bit about how do you make sure that you don't have a problem. And there is a beautiful slide, but unfortunately I can't share my screen to show it to you. I'm going to try and describe it to you. So there's one line that goes up and tapers down. And this line is, the bottom of it is you've got low inflammation right now. Then you're exposed to a virus and your immune system gets activated, it takes care of it, and it goes right back down. That happens to over 80% of the people on the planet who are exposed to this virus. But then there's another line in this graph. It doesn't start here where the green line is, it's a red line, and it starts up here. That the level of inflammation, remember if this is, you get a little inflamed, the immune system gets activated, there's inflammation, and then it tapers down because the inflammation kills the virus. But then the second line starts up here, much higher, as the baseline of inflammation. Now you get exposed to the virus, and the same kind of immune response comes up, and it deals with the virus, is trying to fight the virus, but now you're at fatal levels of inflammation. And this is what's happening to people who are put on respirators in intensive care. 89% of them die. In New York, they published a paper, the Journal of the American Medical Association in March, that 89.1% of the people in intensive care who were put on respirators died. Well, what's that about? Well, that's called the cytokine storm. A lot of inflammation, and the cytokine storm starts, but their baseline of inflammation was much higher. We call that comorbidities. That's the geek term for it. So people that had high blood pressure, they're always inflamed. People that have high cholesterol, they're inflamed. You know, people that had diabetes, they're very inflamed. So their baseline of inflammation is higher than the rest of the population when they're exposed to a virus that activates your immune system. So the goal here is to drop down the baseline of inflammation. So when you're exposed to a virus or any threat, your immune system, trying to protect you, can activate properly, and you don't run a risk of having excess amounts of inflammation.